I'd like to introduce Dr. Nanette Wenger, and I'll bring you to the podium in just a minute after I brag about you, but she is a pioneer in cardiology, in particular women's cardiology, and she has been the quintessential mentor, educator, clinician, researcher, and most importantly, she's an advocate for you all, which is why she's here. And I really appreciate her taking the time to speak to you all today. Dr. Wenger. You can advance just with the arrows. Mm-hmm. Like that. Oh, this one's sorry. This one. And there's a.
Good afternoon. I'm absolutely delighted to be here with you. And let me tell you, this is going to be a change in emphasis. We spent the day thus far talking about disease. Now what I want to talk to you about is heart health. And we'll be talking about how you can show your heart you care. These were originally put together for the prevention of heart disease in women, but as you will see, they also apply in great part to the men in the audience. Let's give a minute or so of background. Cardiovascular diseases cause more death in women than cancer, respiratory disease, Alzheimer, and accidents combined. And we're not doing well. In recent years, what we're seeing is increasing death rates from cardiovascular disease among young women. And that reversed a trend of decrease over the past decades. And likely some of it is related to the, I don't know what's happened, it's related to the obesity epidemic and sedentary lifestyle. And one of my colleagues called this the leading edge of a brewing storm. Because if heart disease develops at young age, just think what is going to happen as the population ages. And of major concern is that there is a major difference. Black women, more than white women, have higher disease of cardiovascular disease rate and are less aware of the cardiovascular problem. Now, this is going to be an owner's manual for the heart. You know, we have owner's manuals for our cars, for our dishwashers, for our washing machines, but nobody has given us an owner's manual for the heart. And that's essentially what I'm going to try to give you today. And you know what the owner's manuals have. These are the technical specifications about the parts and features of your heart. It's a muscular pump, a little larger than a clenched fist, maybe a little larger than my fist, but those of you with a big fist, put it up. It weighs less than a pound. It beats over 100,000 times a day and pumps about 2,000 gallons of blood every day, nearly 5 quarts of blood every minute. Together with this, we have 60,000 miles of arteries and capillaries and veins. But if you follow this owner's manual and take care of your heart, the warranty is about 81 years for a white woman and maybe 77 years for a black woman. But you have to read the owner's manual carefully for operating instructions. Now, the idea is that we want to empower women and men by awareness and education. And my message to you is that favorable changes in lifestyle can decrease cardiovascular risk and prevent cardiovascular events. And it's a continuum of risk. Low risk, low intervention, high risk, high intervention. But my message is that behavioral changes by women and reshaping preventive practices by healthcare providers can decrease the number of women who die every year from cardiovascular disease. So this, if you will, is a partnership between women and their healthcare providers. Now, the operating and maintenance instructions are lifestyle, and that's all I'm going to address with you today, but they're also risk factor interventions and preventive drug interventions. Now, let me give you just a couple of examples of where we're going. What about the health benefits of stopping smoking? If you quit smoking before age 50, You have half the risk of dying over the next 15 years compared with if you continue to smoke. If you stop smoking, lung function improves 20 to 30% within just a couple of months. After a year of stopping smoking, the risk of coronary disease is reduced by 50%. And within 5 to 15 years of smoking, the stroke risk is similar to that of which you've never smoked. What about something as simple as walking? Walking cuts women's heart disease risk. This is an old study going back to the last century. The Nurses' Health Study. These were women of middle age. Vigorous exercise and brisk walking reduced the risk of heart attack or coronary death by about a third. And even women who were sedentary but later began moderate walking reduced their heart attack and coronary death by about a third. And walking even at a slower pace is also beneficial. Just get moving. And then let me share with you Wenger's 250-250 rule. Exercise an extra 250 calories a day. Eat 2 fewer calories, 250 fewer a day. Look at those packets of sugar and see how many calories are in there. That's 500 fewer calories a day. Multiply it by 7, 3,500 fewer calories a week is a pound of weight loss. And the fact is, lifestyle changes work. Let me give you an example. Again, an old study published in 2002 for diabetes prevention. And the bottom line was that diet and exercise delayed diabetes in an American population of overweight people who just had impaired glucose tolerance. This was physical activity for 30 minutes a day, even moderate. Weight loss of just 5 to 7% of body weight reduced the risk of getting diabetes by 58%. And then there are a few things that are harmful. We call those in our guidelines class 3 interventions. Menopausal hormone therapy is not preventive. It may not be harmful, but it doesn't prevent cardiovascular disease. Antioxidant supplements, the vitamin C, the vitamin E, the beta-carotene. They may not be harmful, but they don't prevent cardiovascular disease. So let me say it again, because for years, I know how much problem I had having my women patients take the medicines that were good for their disease, just didn't want to stop their vitamins. Vitamins don't prevent cardiovascular disease. Hormone therapy doesn't prevent cardiovascular disease. Now, this is a list that I'm not going to go through in detail. It's specifically for women, but these are some of the diseases that can increase your cardiovascular risk. And if you have any one of them, discuss this with your clinician to see if anything specific has to be done in addition to your heart healthy manual. Now, here is the beginning of your heart health manual. And this is the American Heart Association's Life Essential 8. Now, what are these Life Essential 8? Eating better, being more active, quitting tobacco, something very new in this guideline, getting healthy sleep, managing weight, managing cholesterol, managing blood sugar, and managing blood pressure. So really, there are 4 behaviors: not smoking or vaping, getting adequate sleep, that's 7 or 8 hours a night, a healthy diet, and this morning it's all set up for me. You heard for the DASH and the Mediterranean diet, and physical activity, 150 minutes or more every week. And then 4 health factors: blood pressure, which we've talked about, blood lipids, a healthy weight, and blood sugar. Now, what are the tips for success? And I'll go through each one of these 8. And I want you to look to see how many are similar among these Life's Essential 8. First, how to eat better. Watch the calories, cook at home, look for the heart check. on the packages, meaning that they're heart healthy. And if you're in need of inspiration, go to the American Heart Association's website, and all of these details will be on it. How to be more active. First of all, set your goals, and then keep going. Just walk more. Don't pick up the phone and call a colleague. Walk down the hall and talk. Park your car in the farthest part of the parking lot and walk. What bothers me is people who go to the gym and fight for the closest exercise spot for their car. Stay active. Add it up. All the walking counts. And then make it a habit. And what you will find is that exercise is a very enjoyable part of your life. Do the kind of exercise that makes you happy. Quitting tobacco. Now, this is serious business. You have to learn how to deal with the urge. Well, first place, if you don't start, then it's not a problem. So first, it's not starting. But deal with the urges. Get active. Handle stress. Smoking so often is a response to stress. Get support. There is plenty of support out in the community. And then stick with it. But remember that each time you try to quit smoking, you have a greater chance of success. Now, getting healthy sleep. Move it. Take all your devices away from the bedside. Dim it. Keep the light level very low. Set it. Not setting the alarm to wake up, but setting the clock to go to sleep. Locking it. Lock all your devices. Get them away. And blocking it. Block the light. And then how to manage weight, and we've heard about some of that. Control the portions, but here we're back again. Get active, eat smart. You saw the design of the plate, of the healthy plate. And then get help. Nutritionists can really give you great value in terms of guidance. How to control cholesterol. Eat smart. Move more. We're coming back to activity. Know the fats. Stay away from the saturated and the animal fats. No nicotine. Stay away from the cigarettes. And then if you require cholesterol-lowering medicine, take the medicine every day as directed. If you're on medication, it does not help you if it stays in the bottle. It really has to get into your body. Managing blood sugar. And here we're back again. Eat smart, move more, manage weight, and no nicotine. Managing blood pressure. Here we're coming back. Look, if you do the right things, how many risks it affects. Eat smart, move more, manage weight, no nicotine, and sleep well. So now, essentially, I've told you how to show your heart you care, and that is to read the manual and follow it, and follow Life's Essential 8 for lifelong good heart health, and I thank you for your attention.